Welcome back to Body Beautiful. We're talking right now with Dr. Joseph Mele about breast augmentation revision and what it is and who needs to do it. We'll be taking your calls with any questions you have. The phone number 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And remember, if we give you any advice, you certainly want to also get a second opinion with your own physician. Before we get to some photos, we have that and the phone calls, which are already stacking up here. We talked about the expiration date on implants.
Yeah.
In the warranties.
Yes. Yeah. There's no expiration date. There's not, at a certain time you have to have them changed.
Right. Okay.
There's usually some clinical indication why we're wanting to modify the implant or change them.
And you would see that. I mean, a person who has them, it wouldn't be like some, you know, we say, okay, it's 5 years now. They've just got to be taken in and warranties up. And I mean,
that is not the way it works. Correct.
No. So you would have to actually see or experience some kind of physical issue.
Yes. Yeah, and with deflation, especially with the saline implants, it's fairly obvious. The volume is lost. It's a little more difficult with the gel-filled implants because the gel sometimes will stay within that normal scar around the implant, and then we don't see as big a change in volume.
Okay, now we do have before and after pictures of breast augmentation revision. Let's go ahead and take a look at that and describe to us what's going on here.
Sure.
So let's go ahead and roll that.
So this is someone with the deflation. So you can see on the left side, on the right is before, or actually after it's fixed. On the left side is where the implant has deflated. And you can see there's a loss of volume, especially in the upper pole, as some of that fluid is probably still in the implant in the lower pole of the breast.
Okay, so that's really evident. I mean, you can see it especially up at the top of the chest there.
It's indented, it should be rounder.
Okay, and so would you go in, say if it's saline, would you actually just go ahead and inject more saline into it, or no? You have to actually take the...
There's no fix-a-flat. You have to go in there, take out the implant, put a new implant in.
You know what, doctor, thank you for working with that whole analogy, which I think we're going to beat into the ground here, but okay, so it actually has to physically be removed.
Yeah, it means there's a defect either in the implant or in the valve. So a new implant is placed.
All right. Let's go ahead and take some of our calls. Good morning. We have Loretta on the line with us. Good morning, Loretta.
Oh, yes. Good morning.
Good morning.
Do you have a question for Dr. Mele?
Yes. I had a younger sister that had breast implants, and apparently one is larger than the other and harder, and she's in somewhat discomfort. I was just wondering how would this affect her long-term health?
Sure. Now that's something that she should follow up with her plastic surgeon, because although breasts usually are asymmetric, one side's usually bigger than the other. I don't know if that was the case beforehand or after, and I'm not sure how far out she is from surgery. If she was a patient of mine and this was a few weeks after surgery, she would need to come in the office right away because you have to worry about things like bleeding or infection that can cause an increased size and pain. If this is something that's been done years ago, she may be developing what's called capsular contracture, which is where the scar around the implant becomes tighter, and it can change the shape of the implant, actually give some discomfort with that too, if it's what we call a grade 4 capsular contracture. But it's something she would need to come in and be examined for.
Thanks, Doc. Let's go ahead and take another call. Patty, good morning, Patty.
Good morning.
Do you have a quick question for the doctor?
Yes, excuse me. I'd like to know if a diabetic can have a breast implant. I mean, not a breast implant, but breast reduction.
Oh, breast reduction, sure. Absolutely. The most important thing is that the diabetes is well controlled. So I usually do this in conjunction with your primary doctor who's taking care of your diabetes and make sure we've got the medications dosed appropriately, that the glucose level is well controlled. Because if the glucose is out of control, if it's getting high before surgery or during surgery, even the period after surgery, it can put you at higher risk for complications, which we obviously don't want to have. But the surgery itself can be safely done.
So with diabetes, does it take longer to recover from surgery in the healing process? Is that
it can. Issue? There can be a prolonged recovery in terms of the actual knitting of the wound, healing of the wound, and also a little higher risk of things like infection. Okay,
so in Patty, she was also talking about breast reduction surgery, which they're not really, that's more major than a breast augmentation surgery?
It's a bigger wound. To say it's a larger surgery in that we have a larger surface area that we're working on. With breast augmentation surgery, we're trying to make the smallest incision we can and make the pocket for the implant. With breast reduction surgery, we're trying to remove breast tissue. So we're removing breast tissue and we want to put it together in a nice way.
I'm sorry I can't take all the rest of the calls. We are switching topics. We're actually moving up in the body to the eyes. Before we go to break, if you want more information about Dr. Dr. Mele, you can call him 925-943-6353 or check him out on the web at drmele.com. When we come back on Body Beautiful, we'll have more of Dr. Mele, who will tell us everything we need to know about eyelid surgery. We'll be right back.